Thank you everyone for coming. It's really exciting to be in a room with so many people invested and shifting to a public health approach to our criminal legal system and using those skills to address the injustice at the heart of our system. I am Emile DeWeaver. I'm an abolitionist. And so what that means is I believe in creating the services in the world and the approaches that mean we don't need prisons anymore. And so that's the lens from which I come. And I want to begin with talking about how it is that we have been approaching criminal justice and how it is that abolitionists would like to approach, or at least me as an abolitionist. And you're going to hear a lot about particular programs in these sessions. And I want to talk about not the what we're doing, but so much the how we do it, the principles that underlie the programs we design and the programs we support. Because what I have found is that in shifting from this punitive system, the how of how we do it is just as important as the what. So I'll start there. Before, for the last 20 years or so, we've been approaching criminal justice like what I call a broken car factory. So I want you to imagine a car factory that's putting out cars, and the cars have defective brakes. And people are buying the cars and they're driving and they're crashing on freeways. And the car manufacturer is like, oh my God, recall all the cars, recall all the cars. And they call all the cars back in and they fire a bunch of people and they hire new people, better minds. They do nothing about the factory that is producing broken brakes. They put out more cars with broken brakes. More accidents happen. Oh my God, recall all the cars, recall all the cars, fire these people. Let's get some legislation. Let's reduce the speed limit ways. Let's pay settlements to these families. Let's do all these things, but fix the broken brakes. And they keep recalling cars with broken brakes and keep coming up with 101 different solutions to mitigate the harm that broken brakes are causing, but no one is getting to the root of the problem. That is, your car, your factory is putting out cars with defective brakes. What we are hoping to do in the world of abolition is fix the brakes. And that is what are these brakes? Well, these brakes are the root causes of this thing that we call crime and the harm that happens in communities. And some that you're probably familiar with are poverty and unemployment and childhood PTSD. But if we dig beneath the roots of poverty, the roots of unemployment, the roots of childhood PTSD, and we're honest about who that disproportionately impacts in our country and why it disproportionately impacts Black and Brown people. We see at the root of these root causes is a deeper root cause, and that is white supremacy or racism. We're used to talking about it in terms of racism, but racism is a tool, it's a means to an end. The end that tool is trying to achieve is white supremacy. And so if we're going to fix the brakes on those broken cars, we are talking about a systemic power structure, and we need solutions based on conversations about power, and in particular, the redistribution of power from racist institutions that we've all inherited to the people and communities harmed by these institutions. So I begin, and I'm describing this broken car factory to illustrate how a failure to center power in root causes has undermined many of the policies and programs that fall into the criminal justice reform bucket. And as we seek to supplant this punitive legal system with a public health approach, I think it's important to name that we need to hold ourselves accountable, even in the discipline of public health, of first centering the redistribution of power, and second, prioritizing root causes. And this way we guard ourselves from dumping our genius and our funding into building another broken car factory. I think a really concrete example of us not doing this comes in California's care courts that sound like a good idea, this idea of let's divert. We have this system that is broken. It is the status quo. And they're hearing the call from people that, hey, we are taking the wrong, we need to take a public health approach. That is like a pretty popular public outcry that politicians are finding it more and more difficult to ignore. And so what do vested interests do when the public is growing in support of something that's not within their interest? Well, of course, they subvert it. And one way that happens is we're not paying attention to the power and the distribution of it. And this happens and is happening in California's care courts, where they are developing this idea about diverting low-level people who have committed crimes that are considered low-level into care courts. But in doing this, they are also creating new departments that are the same, that are part of the same organizations that are part of the problem. They're investing more power in them. They're getting more funding for them. For example, they are requiring people who benefit from the program to use certain advocates. These advocates are employees of the court or employees of another related agency. And when you look at a program like that, you have to examine that, well, wait, if what we're saying is this court, let's call it courtroom A, is part of a larger problem, and it's been doing things the wrong way and for the wrong reasons for a very long time. And so we want a new solution. And then your new solution is basically an outgrowth of that same court. How do we imagine we're going to get a different result? From an advocacy point of view, a real simple shift to that kind of thing is like, well, why can't advocates be from advocates for the people who are getting developed? Why can't they be from community-based organizations? Why can't they be from these people's families? So that is a plan that removes some of the power from a court that is broken and places it back into a community that is being harmed by this broken court. And so that's an example of a policy change that centers power versus a policy change that does not center the redistribution of power, and that will then just produce the same system, a larger system. We see that also with mental health in jails. Jails are getting more funding to supposedly take care of mental health needs. And that might sound like a good idea, but you are increasing the very funding and the power structures of the institutions that we have already identified as the problem. And so my presentation will be short because it's about process. And I look forward to any questions you have about what it looks like to center the redistribution of power in program design and in policy design. Thank you.